Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where world-class healthcare leaders seek to solve big problems. Listen as we talk to today's health system CEOs about the journey to achieve their moonshots.
Welcome to our inaugural episode of What's Your Moonshot? My name is Jean Tkachuk. I'm a managing director here at Alvarez and Marsal and one of the leaders of our health system practice. I'm honored to be joined today by David Shulkin. He serves as a senior director to A&M, and based on his years of service in leadership and healthcare, he's a great resource for our practice.
Jean, it's great to be with you, and I'm really excited about the What's Your Moonshot podcast. I have a pretty simple story. I started my career as a physician, trained in internal medicine, and then went on and got outside training in management and in health services research, and really understanding why things work and don't work in health systems. And I spent a lot of years managing health systems, first as the chief medical officer of the University of Pennsylvania Health System for about a decade, had a chance to be a dean of a medical school, and then started to run my own organizations as the CEO of large healthcare organizations in the Northeast. And then a little bit more than 5 or 6 years ago, I got a call to help the Department of Veteran Affairs turn around a pretty significant situation, which many people may remember as the wait time situation. So I joined as the Undersecretary of Health, which is the CEO of the VA healthcare system, and then went on to become the secretary and joined the president's cabinet in 2017.
We'd like to tee up the first episode and launch this podcast. We'll be doing a number of these over the next few weeks, but hopefully, David, you can give us an idea of what the objectives are and what we hope to achieve through this conversation.
I think that there's never been a more exciting time in healthcare, but there's never been bigger challenges for us either. The issues about what works in our healthcare system and what doesn't work in our healthcare system have become so much clearer during this recent pandemic. And so healthcare leaders need to dream big, and they need to be able to think about how they can do their part in changing healthcare for their communities. And having been a health system CEO, so much of what you do is hard work, trying to make your healthcare system work every day, making it work both clinically and making it accessible to patients and making it work financially. But every healthcare leader has a dream, and that is to do more than just the operations of their healthcare system. It's to really make a lasting change and to improve the health and wellness of their communities. And that's what this podcast is about. It's about having a chance for those leaders to talk about those big goals and those big objectives to really make a difference. And for many in healthcare, we're really talking about their legacy.
We're certainly looking forward to this conversation. And David, you mentioned the term moonshot as a way to describe a potential of solving some of those significant problems in healthcare. And I think it's an interesting way to size up a problem. And I probably one of the few that maybe was around when Kennedy was talking about a way to really for the country to really rally behind an enormous goal. And one that would have been impossible to achieve if it weren't for our collective ambitions, focused intellect, and collaboration and execution.
I remember it when I was a child and just watching with unbelievable amazement as we landed a person, Neil Armstrong, on the moon, and he took his first steps. But for me, running healthcare systems, the story about the man in the moon was actually more impactful because I heard a story down at NASA when the president was touring in Houston at the center, and he stopped a man with a broom who was a janitor at NASA and said, what do you do here? And the man with the broom turned to him and said, Mr. President, I'm helping send a man to the moon. And what that said to me was, when you have something really aspirational and inspirational, that's what galvanizes people to work together in teams to achieve great things. And it really gets an alignment of interests. And so that story has really been very important to me throughout my career. I had my second opportunity to be influenced by a president with a moonshot when I was in government. I worked very closely with Joe Biden on the cancer moonshot. And I would meet with him along with other leaders in the federal government every week in his office, and got to see the way that he leads and his passion and dedication to finding cures for cancer and improving the way that we cure cancer. And as a leader in the organizations that I've run, including the Department of Veteran Affairs, I've always had moonshots. I had a moonshot to cure hepatitis from every veteran in the United States. And today, there will be less than 10,000 veterans who still have hepatitis C. I had a moonshot to eliminate the access wait time, which seemed like an impossible goal when I joined government. But today, there's same-day appointments in every VA across the country. So having big goals and objectives sometimes is possible to achieve. Sometimes it's the journey that's really the important part. But this podcast is about having people tell us what their moonshots are.
Great. Yeah, I'm certainly looking forward to it. I know that the pandemic of today, I think, has really forced all people who are involved in healthcare, whether it's on the front lines or those in leadership or those who support healthcare from a policy or an advisory perspective, really forced us all to think very differently about how we approach problems. And I know that we've seen significant issues around health disparities and health equities. Um, and I know, David, that you've done some writing recently and published an article in the New England Journal about Operation Warp Speed, which I think will go down in history probably as one of the most significant moonshots ever made, whether it's putting a man on the moon or focusing on curing AIDS or cancer. This one, I think, will be one that we all remember as we look back on the pandemic. What can we learn from that moonshot as we're thinking more about the moonshots that we might plan ourselves in our own organizations?
For those people that are a little bit younger than me, this clearly is the moonshot of their generation. When we think back to when we first started learning that COVID was going to be a significant problem, it was only a dream that we could get a vaccine. It had never been done. And now that we look back 8 months from conception to commercialization at a cost of $18 billion, but that money invested is really just a small amount of the cost and human tragedy that's been associated with 3 million people across the world who have died from this disease. And of course, it shut down economies across the world. So when you look at how did this moonshot get accomplished in Operation Warp Speed to get us a vaccine so quickly, I really think we have to try to learn from those lessons. And to me, it was pretty amazing when you break down the way that this was done, how if we begin to apply those same techniques to other big problems in healthcare, I hope we can replicate it and we can have miracles. And so I looked at this strategy of how they did this and broke it down into something called the rapid sprint. Now, as everybody knows, a sprint is when you don't hold back. You expend every bit of energy in a race until you cross the finish line. And that's what was really done in Operation Warp Speed. And so if you take a look at it, rapid sprint, the R stands for getting results. And that means setting the initial goals and objectives to be big goals and objectives. In fact, Operation Warp Speed set we'd have 300 million doses of the vaccine by the spring of 2021. Everyone thought that's ridiculous,
Ridiculous.
but we certainly achieved that. The A in Rapid Sprint is for agile development. That means you break complex problems into manageable tasks. The P is for public-private partnerships. Operation Warp Speed would not have happened if it was done just in the private sector or just done in government. It was that partnership that mattered. The I is for pre-fund the investment, how it was pre-funded. So you didn't have to go through constantly asking for additional budget money. Everything, including all the steps of commercialization, was funded up front. The D in Rapid Sprint was for making different bets, diversification. They picked 8 different companies, 8 different strategies, and frankly, they knew they weren't going to all work. But if you're going to get there quickly, you do diversify. The S for the sprint is serial competition. This was a competition of these 8 companies. And in fact, there were many more outside of the formal warp speed process looking to compete to get a vaccine to market. That drives everybody to do better work and faster. The P was for parallel processing. We didn't do this sequentially like most projects are done. It was done actually in parallel. They were working on the logistics and distribution before they even had a vaccine. The R of Rapid Sprint is to take risks. And good leaders allow their teams to take risks because everybody knows every great success is associated with some failures. The I in Rapid Sprint is for internal alignment, so that there was a combined aligned interest and people did share information and work together that naturally had been competitors. But when there's a common good, good leaders align interests. The N is to narrow the focus. You can't pick everything to try to succeed. You have to use educated information and hypotheses and data that you have available to narrow down where you think you're going to achieve the result. And finally, T is technology. If we take a look at Operation Warp Speed, they used 4 technological platforms that they were betting on to find the vaccine. We in the public now know about it pretty well because we always talk about mRNA now and adenoviruses and recombinant proteins, and fortunately the mRNA platform worked well, and the adenoviruses with Johnson & Johnson and AstraZeneca are effective, and we're evaluating more now their safety and profile. So that rapid sprint process is one that can be used effectively to achieve moonshots.
Thanks, David. I really like the way that you've identified that process of rapid sprint. I think a lot can be learned from that. And I think that's what we're trying to do with this podcast, right? I think that we're trying to take an example like Operation Warp Speed and listen to what other healthcare leaders might have in their minds in terms of a true moonshot, either in their market or nationally or globally, and then potentially listen to what some of their plans might be in terms of how to accomplish that. So is that what you're expecting, David, from the podcast as you're talking with leaders from across the country about potentially joining us?
What I want is to give people the platform to share those ideas, because you never get real change unless it starts with an idea. And what I hope is that once those ideas are out there, that begins to start developing the type of plans that people have to realize those goals and changes and dreams. So we would have never gotten to the moon if it wasn't for President Kennedy. We would have never gotten a vaccine if it wasn't for the scientists and the government leaders to dream that we could do this. And some of the big issues in healthcare, you mentioned one of them, disparities in healthcare, are not going to be fixed unless we not only put out the goal, but develop a plan on how we're going to get there.
Yeah, dream big, certainly. Well, I'm certainly looking forward to that, David. I want to be certain I thank you very much as one of our advisors. I think this is an example where we can take experiences of others and bring them to the forefront and really share them with leaders. So very much appreciate your thoughts behind this, and look forward to our next podcast.
Great. Thank you so much, Jean. Look forward to it as well.
Alvarez and Marcel. Leadership, action, results.